Hello, my name is Mike Galbraith. If you remember my informative speech topic from a few weeks ago, you should remember that I'm recovering from knee replacement surgery. Today I will be demonstrating the physical therapy exercises that I must do 2 to 3 times per day. I will discuss the purpose of the physical therapy, demonstrate the motion and the strength exercises, and will discuss the importance of the final step of therapy. Studies reported in the National Library of Medicine indicate that patients can lose 50% of their muscle strength in their legs after knee replacement surgery. Other medical experts have said that patients lose muscle strength as the body is reacting to trauma. Your brain shuts down activity to the area to help prevent further damage. Physical therapy is needed to regain strength to the knee, but also to regain a normal range of motion. The range of motion goal is from a straight position of 0 degrees to a bent position of about 120 degrees. I will start with the strength exercises. These exercises are intended to regain strength in my knee and in my leg. The first strength exercise is a straight leg lift using a small weight attached to my ankle. In this exercise, I keep my knee as straight as possible while raising and lowering my leg. The next strength exercise is a seated knee lift while again using a small weight attached to my ankle. In this exercise, I place a roll underneath my knee and raise my foot, extending my knee to a straightened position. The next strength exercise that I do is a stair step exercise. In this exercise, I step up and down using my knee that the surgery was done on. This exercise helps gain strength and stability in the knee. Another strength exercise that I do is a seated knee bend with resistance. In this exercise, my wife holds a rubber strap around my ankle and I pull against the strap, bending my knee. The last strength exercise is a leaning leg squat exercise. In this exercise, I place my feet out away from the wall and my back against the wall. I then perform squats, bending both knees and then straightening them back out. I will now demonstrate the stretching and motion exercises. These are intended to help regain the range of motion in my knee. The first stretching and motion exercise is a standing stair step knee bend. In this exercise, I have to stand with my knee on a step and lean into my bent knee, stretching the bend of the knee. The next exercise is a seated knee bend. In this exercise, I sit on the floor and pull my foot towards me using a belt for assistance. The next exercise that I do is an exercise to help straighten my leg, stretching my thigh and calf muscles. This involves me pulling on my foot with a belt to stretch my calf while my wife pushes down on both sides of my knee to help stretch the quadriceps and hamstring muscles. By the way, this is a very painful exercise. The last stretching exercise is a seated knee bend. In this exercise, I sit in a chair and my wife assists me in bending my knee past 90 degrees. As with the leg straightening exercise, this is also a very painful exercise. Finally, the last step in my physical therapy exercises is to ice my knee when I am done. There is a large amount of heat generated around my knee from doing all of these exercises. Placing an ice pack on my knee helps reduce the heat being generated and also helps reduce the swelling and inflammation. This is a very important step to help keep the excess swelling under control. In conclusion, today in this video, I have discussed the purpose of physical therapy, demonstrated the strength and motion exercises that I have to do, and discussed the importance of icing the knee at the end of the therapy. Hopefully this demonstration gives you some insight as to what is involved in recovering from knee replacement surgery. In the words of the late Jim Rohn, take care of your body. It's the only place you have to live.